Okay, so let's talk about fibromyalgia and trigger points. There are a lot of you are out there that are interested in the diagnosis of fibromyalgia. And let me just let you know, if I say anything that sounds like I'm making fun of it, I'm not. Let me just let you know I have suffered, still suffer. I mean, you don't never not suffer from fibromyalgia, but I had fibromyalgia that has improved dramatically through a lot of the things that we've learned. And the diagnostic procedure to this day. No, well, not to this day. We're actually going to. It's still used, but we want to clear it up for you. The whole trigger point thing. I mean, again, I don't want to be facetious, but people come into me and they go, "Wow, I had 11 of the 11 of the 18 trigger points," and so that criterion says I have fibromyalgia, and I'm like, well, I don't know about you, but like when I was really hurting, I mean, I had like 111 trigger points all over my body, and that's probably isn't the best criteria to use. The super sensitivity that produces that probably is a better criteria to use, and Dr. Gates is going to cover that in a minute. So we're going to go over a couple of things real quick. What the criteria were for diagnosing fibromyalgia through these trigger points and what it means, what the criteria is now, and where the trigger points figure or do not figure into that current diagnostic scheme, and maybe start promoting our concept that maybe fibromyalgia needs to change its name.
Mm-hmm. Beautiful. So let's go with the trigger. That was perfect. I love it. So let's go with the trigger points first. So in 1990, the American College of Rheumatology established the trigger point guidelines for fibromyalgia, where if you have 11 out of the 18, then likely you have fibromyalgia. And at that point, it was a diagnosis of exclusion. So at that point, you didn't have rheumatoid arthritis, lupus, Sjogren's syndrome, some other autoimmune disease to cause your pain.
And then they told you need to pull up your bootstraps and you need to go
suck it up.
And a lot of see a psychiatrist.
And a lot of rheumatologists were somewhat, frankly, a little angry when the pharmaceutical industry jumped onto fibromyalgia because they were able to sell medications to fibromyalgia patients to help them with their pain. That's talked about extensively in the rheumatology textbooks. And you being a fibromyalgia patient may have the wonderful experience of having a wonderful rheumatologist who loves treating you, but we have talked to many rheumatologists who really don't enjoy treating fibromyalgia patients as well, because it's not necessarily what they meant to do. They want to take care of rheumatoid arthritis patients and lupus patients.
Right.
Now, going on to, what was your second point?
My rheumatoid arthritis, fibromyalgia, the trigger points, and how the trigger points were involved in the diagnosis, and how they are considered now. Dr. Gates just talked about a standard in 1900. Now there's an updated standard for the diagnosis of fibromyalgia, which actually makes a little bit more sense.
Right. And so they basically, in 2010, the American College of Rheumatology went away from the 5 kilogram of pressure trigger point exam to quantifying the person's symptoms. If the person has severe pain for more than 3 months, basically in many areas of their body, there's no other arthritis cause to it, then now they can be diagnosed. It's called a widespread pain index over 7. They can be diagnosed with fibromyalgia. And we recommend all of you look it up. I'm not going to go through all the nuances.
Most patients don't know the term allodynia, but that's kind of the distinctive factor.
Right, and that basically was the underlying factor for the trigger point exam.
Right.
And so allodynia means someone has pain to normally non-painful stimulus. So if I press on Dr. Rutherford, he shouldn't have pain with that. But a lot of fibromyalgia patients will say, ow. And it's because their brain and their spinal cord have become learning of pain responses.
But now that's not just trigger points, right? It's just kind of like, I mean, when I was hurting like everywhere.
And basically fibromyalgia is a big trigger point over the entire body.
Right.
And so everywhere you press, the person is
so the pain. Newer guidelines, I think, will lend themselves to that.
And they're lending themselves to, hey, some people have fibromyalgia who don't have these trigger points.
Right.
And we do know, you can watch our hour-long broadcast on powerhealthtalk.com about fibromyalgia, but we do know that there are many things that are wrong with fibromyalgia patients. Trust us, that it's not just a diagnosis of exclusion anymore. Right. And now, as we just talked about relative to fibromyalgia and small fiber neuropathy, we are seeing there is a peripheral cause to some of the pain, meaning you don't have anything wrong with your muscles, But new research is finding that upwards of half of fibromyalgia patients may have this thing called small fiber neuropathy, where the pain nerves out in the extremities start to dysfunction and send too many pain signals into the spinal cord. And this can be on top of the amplified stress responses that many fibromyalgia patients have, which also make their spinal cord learn pain, as well as the immune inflammation that many fibromyalgia patients have. So that's really the skinny on.
So to bring that into a little more, maybe a little bit more lay perspective, fibromyalgia, which I have said, and many of my colleagues have said for a long time, is a dumb term because it means pain in your muscle fibers. What Dr. Gates just in essence said is, it's not pain in your muscle fibers. Exactly. It's pain.
From the small fiber neuropathy to the spinal cord learning pain because of...
in your nervous system.
Exactly.
It's pain
or your brain learning the pain due to increased stress levels as well as increased inflammation in the body, making the spinal cord more sensitive to pain. Not your muscle cells.
Right.
Your spinal cord.
Okay. Which is why we were saying we think that they need to come up with a different name, because there is a lot of scientific evidence now as to what is actually happening. I think it'll help the fibromyalgia patient, because fibromyalgia patients are still, I don't care, still today you're considered kind of like, okay, yeah, well, I'm not so sure, yeah, maybe you got fibromyalgia, but I think if we can start to base a terminology on the scientific basis of what's happening, and this scientific basis is correct, these are the types of things, this is what we use to address the fibromyalgia patients' conditions. It can be significantly improved. I'm kind of a living testament of that. And so I would lobby right here and now to start the ball rolling of, we need to change the name of fibromyalgia to something else. Now we need to come up with that.
Yeah, exactly.
Yeah. So, okay, hope that was helpful for you. The trigger points, the confusion that a lot of the patients have when they come in here about trigger points. I have them, I don't have them. Do I have fibromyalgia? Do I not? That's kind of the latest skinny on it. It's accurate data. It's been very helpful for us. I hope that it's helpful for you.
And again, thank you for watching. If you have any other questions, go to powerhealthtalk.com.